Hello guys, my name is Luke. I'm a first year student at Marjon University who is studying sports rehabilitation. Today I'm going to run through how to perform a sports massage on a client safely and correctly to get the best benefits for the client. I'm also going to show you how to perform METs, which are muscle energy techniques, on the client, and I'm going to run through contraindications and red flags so you know what to look out for and what to look out for when not treating a client. Firstly, we're starting with the calves. These are muscles made out of, the calves made out of muscles of the gastrocnemius, which has two heads, the medial and the lateral head. The medial head originates in the medial femoral condyle, and the lateral head originates in the lateral femoral condyle. They insert into the posterior surface of the calcaneus, and the soleus is also found in the calves, and they originate in the medial border of the tib and the posterior of the fib. They insert into the calcaneus, and they both help with plantar flexion of the ankle. Before starting any treatment with a client, you should perform and fill out, perform observations and palpations on the client. Before, however, you should fill out a clinical form running through how the treatment is going to occur, and also to get objective information from the client. So from a clinical form, you can collect the onset of the injury, the location of the injury, the duration of how long they've had the injury, the characteristics of the injury, any aggravating factors, so anything that limits them really in their day-to-day life, radiating, the time scale of the injury, and the severity of it as well. And also it gives you an opportunity to collect contraindications and red flags. The contraindications to look out for are open wounds, DVT, undiagnosed lumps, undiagnosed cancer, acute swelling or acute injury, and any high temperatures on the area. It also gives you a chance as well to diagnose things like and see if they're suffering with threads, which is thyroid problems, heart problems, rheumatoid arthritis, epilepsy, diabetes, or have any steroid use. My client today is physically capable and perfectly healthy for treatment. I'm just going to run through first how to keep the client safe, and also how to personally look after them so that they not feel unsafe at all. The client's currently laying on their back, however we need them to turn over so we can perform on their calves. So firstly, what you'd like to do is grab the towel, use your body to hold the towel in place, lift the towel ever so slightly so that they can turn over and keep their modesty. So today we're going to be working on the calves. So firstly, I'm just going to move the towel slightly just to expose the left calf and focus on that one and cover the right one. I'm also going to tuck in the towel into their shorts, but before so I'm going to ask the client if it is okay for me to do so. Is it okay for me to tuck in? Yep. So now we have the whole calf muscle exposed. Before treating the client, you would ask if it's appropriate to touch them, and I've already got confirmation from my client, but however I'll ask again, is it okay for me to touch you? Yep. So starting off, you start with petrissage. Petrissage is just a light stroke up the muscle belly and back down. This increases blood flow, it engages touch with the client so it gets them used to the massage. It also stretches tissue and it aids with removing waste. You keep doing this until the skin goes red. Next, we have petrissage. Petrissage encourages vascular and lymphatic responses. It is performed by techniques like picking up the muscle belly. Just make sure when you're doing this you actually pick up the whole muscle belly and not just the skin. It also has ringing, kneading, and skin rolling. So you pick up the muscle and just roll through. Lastly, you have tapotement. Now, tapotement is only used if the client is pursuing further sport later on in the day or have just finished the sport, as it stimulates nerves and muscles and blood flow. However, the technique used for it are hacking, cupping, which you cup your wrist like this, and beating, which is almost like punching the skin. This client suffers with tight calves, as we can feel. So if you need to, you can lift their leg up, rest it on the shoulder so you can kiss in deeper, like so. Another thing you've got to look out for when treating a client is if they have any trigger points. Trigger points, they feel like a jelly tot underneath the skin. They are a bundle of muscle, and the aim is, when you find a trigger point, is to be obviously in constant communication with the client. To treat them, you would press on them until the client is in a pain of about 7 out of 10. Anything more, then you need to ease up. Anything less, obviously go a bit deeper. Once they hit the pain of 7 out of 10, you then hold it for 10 to 15 seconds. However, it tends to start numbing before the 10 seconds. And then once it starts to numb, you ask the client if you can go deeper, and then you press in deeper, hold again when they're at a 7 out of 10. So you need to stay in constant communication with the client throughout, and then so on. You repeat it 3 times. Also, friction is also used, which is just placing your thumb on this area and just rubbing clockwise. However, this can tire your thumb out quite quickly. We're going to get the client to turn over again. So again, using the same technique of holding the towel, lifting so the client can turn over. We're now going to show you how to perform an MET on the client. METs are muscle energy techniques. They are isometric contractions that improve joint function and musculoskeletal function. So in the calves, you'd just ask the client if you could slide down a little bit. You would cup the heel like so, bring them into dorsiflexion, and then ask them to plantar flex, push down against you at about 40%, and you would hold it for 10 seconds, constantly keeping in contact. Just push, push, push. Once the 10 seconds has stopped, you then ask the client to take a deep breath, let them ease for a couple seconds, and then push them further up, and then you ask them to push again about 40%. This time you hold it for 15 seconds, and then lastly, the third time through, you'd obviously get them to relax again, take them to their new ROM, and then ask them to push again. This time, the last time, you hold it for 30 seconds. The benefits of METs are that it improves the range of motion within the joint and the muscle itself.